Happy Saturday, and thank you for joining me today. Dr. Anna Stratus is going to be joining me in just a moment. You do not want to miss that interview, and we have lots more to get to. We also have a special report coming up on the brain-eating amoeba in Texas. Also, we're going to have reporting on Hurricane Delta and how that's looking right now. But let's begin in Brazil. Brazil is located in South America and borders the Atlantic Ocean. It is the largest Latin American country and has a population of approximately 212 million people. Brazil has presidential elections just like us, and they occur every 4 years. And so in 2018, they elected Jair Bolsonaro. Reportedly, his nickname is, quote, Trump of the Tropics, end quote. Here's reporting from Vox News at the time, quote, Jair Bolsonaro, a far-right politician often compared to Donald Trump, was elected president of Brazil in arguably the country's most important election in its history. He defeated the leftist Workers' Party candidate Fernando Haddad with 55% of the vote. Bolsonaro's victory swings Latin America's largest nation swiftly to the right, marking the latest in worldwide victories for fringe movements and representing a significant break in voters' support for the leftist party that dominated past elections. It also follows coordinated efforts to silence and intimidate journalists who report on the fake news surrounding Bolsonaro's campaign. The article continues, quote, a former army captain, Bolsonaro has capitalized on Brazil's political and economic turmoil by promising to, quote, break the system, end quote. He has a troublesome affinity for military dictatorship and a history of embracing offensive views about women, the LGBTQ community, and racial minorities, end quote. So this is the president of Brazil, President Jair Bolsonaro. And as the coronavirus pandemic became more prevalent, it eventually hit Brazil. The Brazilian president downplayed the pandemic, calling it, quote, a little flu, end quote, until the point when he delivered this literally flabbergasting statement. I remember when he said it because we actually covered it on the show at the time back in June. He said, quote, we will all die one day, end quote. Essentially expressing no concern at all about the lethality of the coronavirus pandemic and how, and really the alarming rates for people who have been dying from the coronavirus pandemic. Then in July, he and his wife tested positive for COVID-19. When he announced that he had tested positive for the coronavirus, here's what happened. Quote, this is reporting from BuzzFeed News. Quote, during the televised interview in which he announced he had tested positive in July, Bolsonaro removed his mask, prompting the Brazilian Press Association to file a criminal complaint to the Supreme Court for endangering journalists who were present at the news conference, end quote. So, at the news conference where he announced that he was positive for COVID-19, he removed his mask. That's what he did. After that, he and his wife later went into quarantine. And after 3 weeks of quarantine, President Bolsonaro said this, quote, I knew I was going to catch it eventually. You know, as I think, unfortunately, nearly everyone here is going to catch it eventually. I regret the deaths, but people die every day from lots of things. That's just life. End quote. So upon departing isolation and feeling better, you would think that he would have learned something from that life-threatening and diametrically terrifying experience, but he did not. After months of downplaying the threat of the coronavirus in Brazil, he himself got it along with his wife. But when he was feeling better, he continued to downplay the pandemic, essentially causing more deaths and more infections. And that downplaying does have a consequence when it comes to the rate of infection and death in your country. And so here is that consequence. On Thursday this week, Brazil reached 5 million coronavirus cases and 150,000 deaths. The Brazilian president's infection did not change the way he led Brazil on the coronavirus pandemic. His leadership did not result in a more sympathetic approach to the pandemic, essentially urging Brazilians to stay home and to wear their mask and to take the necessary precautions when going out if needed. But the downplaying did and is still right now continuing. Contrast that to right now. When President Donald Trump and First Lady Melania Trump tested positive for COVID-19, there were many questions on if the president might change the way he led, or if the president might become more sympathetic and apologize for his reckless leadership on this pandemic. But that did not happen. When President Trump was spontaneously discharged from Walter Reed this week, after only 3 days, he told Americans to not be afraid of the coronavirus and to, quote, not let it dominate your life, end quote. He also stated that he feels better than he did in the last 2 decades. So nothing has really changed on this, and the president is still downplaying the pandemic. And, I'm glad the president is feeling better, but there is some concern if that is actually true. President Trump has received a number of experimental drugs upon becoming infected with COVID-19, and his behavior is honestly concerning. I mean, part of what happened this week is the president called off talks with congressional Democrats on another COVID-19 relief bill, which he later walked back. He also has been releasing videos on the lawns of the White House promoting a drug that he's been given after testing positive, claiming that it's a cure for COVID-19, even though that is not proven. The president can also be heard coughing twice on an interview yesterday, obviously raising some concerns about the president's health, despite him saying that he's feeling fantastic. Now, although the president is still downplaying the coronavirus, the pandemic is still going on. For instance, in Connecticut, they are seeing a rise in coronavirus cases. On Thursday, the city of Hartford announced that the closures of athletic fields would transpire due to the surge in the cases. In Fairfield, Connecticut, a school named Fairfield University has now ordered its students to stay home. According to the CT Post, quote, of the 60 new cases among students, 29 were discovered through contact tracing, the school's data shows, while 22 emerged from external tests taken by students, end quote. Stephen Mansfield, the director of health for Ledge Light Health District, said, quote, the numbers we are seeing today are higher than we have ever seen in this pandemic. Since the very beginning, all those measures and cautions that people put in place back in March and April, they should be doing that now, end quote. The mayor of Norwich, Connecticut, said, quote, we have to be more cautious. I want to see everyone wearing masks in town, end quote. They are also now advising people to wash their hands and to maintain social distancing as cases continue to rise, as far as preventing transmission of the virus. Connecticut has more than 60,000 coronavirus cases and 4,530 deaths. In Wyoming, cases there are just surging. Their governor, Mark Gordon, is urging residents to wear masks and stay vigilant. Yesterday, the Wyoming Department of Health said that there are 54 hospitalized people right now. There are 54 people hospitalized right now. According to Governor Mark Gordon's office, the positivity rate in Wyoming is 5%. In the earlier stages of the pandemic, Fremont County was a huge hotspot, and it has recently seen a surge in cases. As of right now, there are 117 active coronavirus cases in Fremont, which is a 50% increase from the number of cases that we saw in September. In Natrona County, cases there have just been rising as well. Yesterday, a woman became the 54th person to die in Wyoming from the coronavirus. There are now some concerns about schools in Wyoming after 60 students and staff members are in quarantine because they were possibly exposed to COVID-19. According to CowboyStateDaily.com, quote, They write in their reporting about a new coronavirus outbreak at a dorm in the University of Wyoming, writing in part, quote, as of noon Thursday, the total number of active coronavirus cases, UW students and employees, was at 139, meaning 88 students living off campus and 50 students living on campus and one employee living off campus. Some 123 people in quarantine due to exposure to someone infected by the virus, 36 students on campus and 87 people off campus, end quote. On Monday, Wyoming's Governor Mark Gordon, has asked the National Guard to assist in contact tracing. On Monday, the Wyoming Department of Health offered at-home DIY coronavirus tests. In other words, at-home do-it-yourself coronavirus test. I actually reported back in, I believe it was back in March or April when this happened, because Denmark was doing the same thing. It was the state public health director who said this in Wyoming, quote, "This unique testing service includes online supervision of the sample collection process. It's a new option that adds to the choices available for testing in Wyoming for our residents," end quote. She went on to talk about how the state will receive 170,000 coronavirus tests between now and December. That is part of the distribution of 150 million tests, which will be distributed across the country from the federal government. Another state that we have been continuing to follow on this show, and that is seeing just a continuation of rise in infections, is Iowa. Where the Iowa total number of people infected with COVID-19 in the Iowa City School District has risen to 76. That includes 44 students and 32 staff members in the district since August 15th, when school essentially began. Despite Iowa's Governor Kim Reynolds demanding schools reopen, the Iowa City District has said no and is isolating their students in favor of CDC recommendations. Nevertheless, Iowa is also reporting an all-time high in coronavirus patients receiving treatments. KCRG reports, quote, "As of Tuesday, 449 people are receiving treatment in Iowa hospitals, an all-time high. Roughly 25 are UIHC, which is average. Less than half are in the ICU," end quote. Iowa is also now seeing a rise in hospitalizations, and their positivity rate is at 17%, which is the fourth highest in the nation. Reportedly, Governor Kim Reynolds has adopted a voluntary mask and distancing policy approach. Earlier this week, the White House Coronavirus Task Force noted that there are, quote, "many preventable deaths in Iowa," end quote. On Thursday, Oregon reported a record number of new coronavirus infections in schools. Governor Kate Brown said, quote, "My priority is getting kids safely back in school, but that becomes more difficult as COVID-19 spreads," end quote. We also learned on Thursday that 14 schools in Oregon are reporting new coronavirus outbreaks. In New Mexico, Governor Michelle Lujan Grisham said we are heading in the wrong direction, and she is warning that her state could potentially become the new epicenter in the nation for coronavirus cases, saying, quote, "We are at extreme risk of uncontrollable spread," end quote. We are going to have more reporting on that tomorrow as this story continues to progress, and as we are just watching this dire concern right now in New Mexico as coronavirus cases are continuing to rise exponentially. But here's an update on a story that we've been following on the Jeremiah Patterson Show, and it's about Georgia. Last weekend, I talked about Georgia withholding information from the public on COVID-19 outbreaks in schools. Well, as part of pursuing that reporting from the Atlanta Journal-Constitution, I emailed a person who is in charge of media relations at the Georgia Department of Health. We have gotten no response back yet, but we live in hope. But what has happened this week is very intriguing. A lawsuit has been filed against Georgia Governor Brian Kemp. This lawsuit has been filed by a teacher. The Atlanta Journal-Constitution says, quote, "The lawsuit alleges that lax state and local standards have exposed staff, students, families, and the Paulding community to risk of infection by the sometimes deadly virus," end quote. The article goes on to say, quote, "The Georgia Association of Educators, the state's second largest teacher advocacy organization with 28,000 members, is a party to the suit, with the anonymous Paulding employee and the education group member described as a longtime teacher. She is referred to by her initials MJ because she fears retaliation by the school district. The suit says that was reporting according to the suit. She lives with a parent who is nearly 80 and who has lung disease. That enhances the risk of the consequences of COVID-19. She also has a child attending the school system who has asthma and severe allergies. Though Paulding offers, and I believe Paulding is a school district, though Paulding offers an online option, this family chose not to enroll in it because the child is a, quote, strong student, and, quote, because of the complexity of the subject matter and the rigorous workload of her curriculum, end quote. Yesterday, in Texas, Dallas County reported 448 new coronavirus cases. The county judge there, Judge Clay Jenkins, is urging residents to remain vigilant and take precautions. He also said, quote, please do not go to large gatherings or any gathering where people are not wearing their mask 100% of the time, which is usually indoors, end quote. Here is actually one of the headlines from the Texas Tribune yesterday. Quote, as El Paso sees record high coronavirus infections, leaders say residents aren't taking pandemic seriously enough, end quote. We're also going to have more reporting on that story tomorrow, as it is very serious right now. Just very, very serious. I mean, the headlines this week. Earlier this week, for instance, Dr. Anthony Fauci. Dr. Fauci, he said this.
We could have from 300,000 to 400,000 deaths. That would be just so tragic if that happens.
300,000 to 400,000 deaths. Can you imagine that? Can you imagine 300,000 to at least 400,000 of our fellow Americans gone? That includes teachers, students, parents, grandparents, workers that you see at the store, medical workers, gone. This is what happens when you downplay. This is what happens when you downplay and you do not take responsibility for your actions. The failure of leadership at the top echelons of the federal government is appalling. It is astonishing, and it is infuriating. When the president himself got infected last week, we thought maybe he will change. Maybe the leadership on this pandemic will change. But the downplaying is continuing. More than 7 million coronavirus cases, more than 7 million Americans now have a pre-existing condition if they did not already have one. And more than 214,000 Americans are dead. I've been reporting for a long time on the coronavirus pandemic and how the CDC is being politicized by the White House and by this administration, by the Trump administration. Here is what a former CDC director, here's what happened earlier this week when this news broke about a former CDC director urging the current CDC director, Dr. Robert Redfield, to step down.
At the CDC, a letter from a former director to the current one is opening eyes wide. Dr. William Fauci, who worked under President Reagan, calls the government's response a, quote, slaughter, and says the current CDC director needs to expose the administration's mistakes, even if it costs him his job.
I kept hoping that the White House task force would see what they're doing isn't working and would change. But this is going to go down as one of the worst responses to a pandemic.
One of the worst responses to a pandemic. More than 214,000 Americans are dead. And yes, it is worth continuing to repeat that number because that is ridiculous. That is unfathomable, and it should never have happened. More than 214,000 Americans are dead. When other nations got their outbreak under control, why was it that the United States was still grappling? Politics and science should never come together. The politicization of this pandemic is sad. And the president has tried his best to irreparably fracture the CDC and to silence any scientist that is willing to tell him the truth about this pandemic, and to manipulate that information for political benefit. This is honestly, it is ridiculous. More than 214,000 Americans are dead and counting. More than 7 million coronavirus cases. Kids are already heading back to school where cases are continuing to rise exponentially, in some states just not wanting to release that information. Don't bother, we'll keep it secret. When the president was exposed for last month, saying that he knew that the coronavirus pandemic was a very, very serious threat, the downplaying continued. When he was infected, the downplaying continued. And now the president is getting ready to hold some more rallies because I'm sure that'll be great for his health. Oh, wait, he's feeling fantastic. And there also is a risk in that, because we do not know when the president last tested positive for the coronavirus. The White House is essentially wanting to conceal that information. The public doesn't need to see it. Or maybe they don't know, because according to the New York Times this week, the president hasn't been getting regularly tested, which is also another concern. The president bragging about testing earlier in the earlier stages of the pandemic. I mean, they used to release that information that the president tested negative in all the test results of the president of the United States. Why are they trying to conceal that information right now? And why is the president going to rallies right now? Why is he holding this? Why is he announcing that he's going to be holding a big giant rally on the South Lawn? A big giant get together on the South Lawn. A little public gathering. Why is that happening right now? Why is that continuing? The downplaying of this will not just go down in history as reckless and incompetent and feckless and horrendous leadership to get this coronavirus outbreak, to get the coronavirus pandemic under control in our country. It will not just go down as that, but this will go down as the most horrendous administration when it came to addressing a pandemic that could have saved hundreds of thousands of lives. The leadership on this is just ignorant. And the diabolical behavior by Jared Kushner, who worked on the White House Coronavirus Task Force, essentially ordering that, we don't need to give ventilators to blue states. They don't need it. They're not our people. This is what will go down in history. The failed leadership on the coronavirus pandemic, some of the most diabolical actions by this administration when it came to addressing this, playing politics. It is infuriating that we are here. More than 214,000 Americans are dead. The downplaying is continuing. What do we do when that happens? Dr. Anna Stratis joins me next.